Welcome back to Health in Today's Woman. Tonight we're focusing on adolescent medicine with Dr. Derek Johnson, a pediatrician at the Murfreesboro Medical Clinic. We've talked a little bit about attention deficit disorder in our first segment. In our second segment, we talked a little about vaccines and also started to look at some of the social issues that are facing these kids. In this segment, I want to continue with that idea of these social issues that they're kind of dealing with. And I want to start off by just talking about this is a time when we're transitioning from childhood to adulthood, and kids are kind of trying to, quote unquote, find themselves. How do you advise parents when we're moving from finding themselves to we've got something that's a little bit more problematic?
Yeah, well, the first thing I do advising parents when they get to that tween age that we were talking about before is you still have to be the parent. You can't be the friend. You have to be the parent.
Right.
Amazingly, I've had some moms come in dressed exactly like their daughters,
right.
Trying to be the friend. That's not a good idea. We need you to be the parent and basically still set limits for your kids.
Right.
Is the main thing I do, and the main thing I say to parents.
And this is a huge issue, I know, because this is a big time when kids are trying to find their way in life, and a lot of parents are also trying to find their way without their children and trying to not have their kids make the same mistakes as may make. You agree?
Right, definitely. There's a fine line between trying to explain to your kids things that, I might have done, we don't want you to do,
right.
And not do as I say, not as I do, and those things. But the main thing I look at is make sure you talk to your kids about drugs, about, sexual activity, and you have to be kind of upfront with them. Don't try to kind of beat around the bush or, be an ostrich and put your head in a hole and think that it's not going on, because there's a lot of pressure, not only at high school but in middle school.
That's interesting. With 4 daughters, I didn't want to hear that.
Yeah, so you really have to face forward and talk to your kids. You really do.
Now, the other thing that's changed now is we've got Facebook, MySpace, we've got Twitter, we've got all these kind of what we call social media sites and ideas going on. Interestingly enough, when we were growing up, we're the same age. We didn't have this kind of stuff. We had other stuff. I'm not saying that we didn't. But do you think kids they're more exposed now than they were then? How do you address that with your parents?
Right. As far as exposure, they're exposed through TV, through media, through like you said, Facebook and other things. And what you want to do is somewhat limit their exposure, somewhat. As far as Facebook, the age that you can get on Facebook is I think 13, but I've had some of my patients as young as 10 have Facebook pages. But as far as when it comes to Facebook, I just tell the parents, if you want your child to have Facebook, then you need to make sure that you know the passwords, you know the codes and everything else as far as to your child, so you can kind of check up on them.
Because it's when I was growing up, we didn't have this issue of anybody being able to be exposed to your child.
Right. And that's another thing too.
I think that's really important, because what I mean by exposure, just pictures, things like that. You had your friend groups here now that has expanded nationally, internationally, wherever the internet goes.
Right. Yeah. And I'm a little paranoid about that even with my own kids. So I try to limit the pictures that are on my Facebook page or things like that. Now the big thing nowadays is, and hopefully I can say it correctly, but it's called sexting. And it's when you take a picture of yourself in either a sexual act or one of your sexual parts or whatever, and then you actually send it out to people, like at a party or somewhere. And that's a big thing. And I try to talk to parents about that too, because once that picture gets out there, it's out there in the whole world.
Yeah, and that's an important concept, because I don't think a lot of kids, when you're 14, 13, even 15, heck, sometimes 21, these kids don't get that fact that once it's out there, it's out there. And where is out there? That's the other thing. We don't necessarily know what that is. I want to take a little bit of a break, or a turn here, and talk a little bit about violence in video games. When we had this discussion about doing this show, you said, "Cuz, that's one of the things that we really need to discuss." What do you advise your parents about violence in video games?
What I advise my parents is that, well, first of all, there was a study done to see if it increases the violence. It was right after the Columbine tragedy.
Right.
To see if violence in the movies that we're watching now and the video games cause these kids to then become violent. And the study showed that there's just no increase of that at all. However, let's just use common sense here and, you know, if you have constantly having your kid play these mature level video games at
Right.
10 where you're killing people and those things, it kind of numbs the child to, you know, violence.
Right.
That violence may be okay or it might be the route to go, you know. And so that's the thing where I try to talk to my parents about. The number one game a couple years ago was, I'm blanking on the name now, but the number one game out was Grand Theft Auto. That's what it
Okay.
was.
Yeah.
And Grand Theft Auto was terrible. It was a mature rated game, but it was number one. You had prostitutes in there. You were a drug dealer. You got points for slapping around the prostitutes. I mean, it was just really a vile game.
Okay.
However, I had parents that were buying them for their kids and had no clue what the game was about. They just were trying to do the right thing and buy the kids a video game.
Right.
So, not saying that that's going to cause a kid to go out and slap a female or whatever, but it's just not good. That's not good at all. You need to use your common sense.
And a lot of parents don't realize what's in these video games. So you advise them they really need to pay attention to what their kids are using and watching and
Right.
and pay attention.
Exactly. I mean, definitely pay attention. I have all my kids' passwords and everything. I check everything that they do. I don't even have TVs in my kids' bedrooms because I want to make sure what they're watching. But the main thing is that I try to stay caught up on everything too. So, and the parent I would suggest too, as far as staying caught up on different acronyms that we might see when you're texting, or you know,
Right.
like parent beside me, or you know, something like that, and try to kind of stay caught up in things and just have open communication with your teenagers. The main thing, you know, just have open communication with them so they can be able to come and talk to you about anything.
And I think that's one of the most important things is that communication. And I think that's something that all parents, it's easy to say and hard to do, especially in these teenage years, is really being able to talk to your kids, and that really can solve a lot of problems. We've had a great discussion about adolescent medicine. We'll be right back after these messages.